listener production.
Hey, Chris Spear with you. Welcome to The Briefing. Whistleblowers working in Australia's mental health system are speaking out, saying there's a growing list of people in need of care, but not the investment and resources to keep up. And without it, people's lives are on the line.
There's sort of one word that comes to mind, which is broken. It's really not a system. I'm not sure there was anything really substantial and integrated there in the first place, but it's certainly just gotten from bad to worse.
That chat with one of the people pushing for change in Australia's mental health system is coming up in the second half of this episode. First though, let's get into the headlines with Tara Cassidy. It's Tuesday, the 3rd of June.
Hey Chris, welcome back and good morning to you listening. Labor will admit its newest senator today. It comes after Dorinda Cox jumped ship from the Greens yesterday, citing a loss of confidence in the minor party.
I have considered this, and during some deep reflection as a First Nations woman, as a proud West Australian, what it is that I would like to achieve in my political life. And what you can't do from the crossbench is make change.
Yeah, and leader of the Greens, Larissa Waters, says the party is disappointed by Cox's decision, saying she'd have more of a chance of affecting change by working with the minor party.
Yeah, in a statement last night, Waters wished her well, noting she was told of the decision just an hour prior to the announcement. While the PM, well, he's got a different tune and he gave her a very warm welcome.
Dorinda Cox is someone who's a former police officer. She's someone who has a lot to offer in terms of policy development. The difference that she wanted to make in the Senate and as a West Australian were better served by being a member of the Labor Party.
Now, it was reported yesterday by some as a surprise move, but it is important to note that she is a former Labor Party member and only joined the Greens back in 2021.
Yeah, and another interesting thing to note, and this is something that Greens leader Larissa Waters pointed out yesterday, is that it was just last week that Cox signed a joint statement actually criticising Labor over approving an extension of WA's Northwest Shelf gas facility until 2070. Now, she also ran unsuccessfully for the Greens' deputy position, with some party insiders also suggesting her future in the party was hanging in the balance after she was also accused of bullying as many as 20 staffers last year. Now, the PM says those complaints have been examined and dealt with appropriately.
A world-first study has found more than a third of Australian men have used intimate partner violence in their lifetime. The Australian Institute of Family Studies surveyed 18 to 65-year-old men and found over 32% had committed emotional abuse against their partner by making them feel anxious or frightened. 9% had hit, slapped, kicked, or otherwise physically hurt a partner while angry. Concerningly, the number of men who reported some form of violence against a partner had risen significantly since the survey was last carried out in 2013, when just 1 in 4 men reported taking part in the behaviour, rather than 1 in 3.
Yeah, and interestingly, this same study found that men with moderate or severe depression were 62% more likely to commit intimate partner violence. And it also found that the men who felt they had strong and affectionate relationships with their fathers or a father figure during childhood were 48% less likely as well, while it also highlighted social support was really important too. Now, this is really important insight because we're told time and time again by the sectors that deal with domestic and family violence that we need to be looking at ways to prevent it, not just deal with it after the fact. And those behind this study make very clear that while these are by no means an excuse, violence is always a choice, it's a step toward better understanding the contributing factors and early intervention areas that we can focus on to try and address this nationwide issue.
Tourists have been sent running down the side of an Italian mountain on Sicily's east coast in the early hours of Monday morning local time after one of Europe's largest active volcanoes erupted. The explosion of Mount Etna reportedly sent plumes of ash as far as 5 kilometres into the air and volcanic streams billowing down its side, with video footage capturing dozens of tourists scrambling to get to safety.
Yeah, and the National Institute of Geophysics and Volcanology says volcanic activity was first picked up early in the morning and has been growing in intensity since, with a red aviation warning issued at the time. Now, that's since been downgraded, with the area still remaining closed to tourists, and they've said that the danger area is confined to Mount Etna's summit, and Sicily's president says that locals are not at risk.
Queensland's eyeing to become the events capital of Australia through a bold new 20-year tourism plan, which includes reviving one of the country's most popular tourist attractions. Premier David Chrysopoulos launched the new campaign dubbed Destination 2045, aiming to dramatically increase visitor numbers to the state and double expenditure to $84 billion a year. It hopes to do that by putting 45 different eco-tourism experiences on display and by rejuvenating the World Heritage-listed Great Barrier Reef.
Yeah, and look, the plan is to attract more visitors to the Sunshine State, particularly into the regional areas, and also to have new direct flights coming here from India. And that'll likely be to and from airports in Brisbane or the Gold Coast, with the Coast Mayor saying that that direct connection between India and Australia will be really key for this plan to be a success. We also know that China is one of the other countries that brings in some of the largest numbers of tourists to Australia as well. Now, I would like to point out, Chris, you were shunning this the other week, but you'll be pleased to know that one of the key draw cards that have been listed as one that will be bringing people to the state is the Royal Edinburgh military tattoo that is coming to Brisbane in 2026.
Yeah, I'm very excited to see that people are rallying around whatever this is. I know it brought you excitement, so I'm not going to yuck anyone's yum, but if you're flying all the way to Queensland just to see the Royal to see the Royal Edinburgh military tattoo, let's have a chat.
Forward closing down at speed, pokes it through for Heyman. Can she round the goalkeeper and find the finish? She can in the end. It's the hometown hero who makes it 4 for Australia.
And the Matildas have sent off interim coach Tom Sermanni with an impressive 4-1 win over Argentina in a friendly last night. The national squad taking to the pitch in Canberra with young gun Amy Sayer scoring twice in the first half, and familiar face Emily Van Egmond and hometown hero Michelle Heyman sealing the deal in the second.
Yeah, the Tillies took the win in front of a record crowd of more than 25,000 fans at GIO Stadium, with outgoing coach Tom Sermanni having this to say after the match.
The crowds are just phenomenal. I still pinch myself every time I've walked out to a Matildas game at home for the passion of the crowd, the size of the crowd, the noise. It's just amazing, and it's just a dream come true.
That was his last game in charge of the national side, with Joe Montemuro, who was also at the game, now taking over the reins of our Tillies. It was a very exciting game to watch, and when you have such a high scoreline like that, Tara Cassidy, with back-to-back goals, I love it.
Yeah, what a way to go out. Now, that brings our headlines to a close for today, Chris. Next up is my deep dive, looking into Australia's broken mental health system and what's causing patients to fall between the cracks. Have a listen to that up next. Australia's mental health sector has reached a tipping point. Every day across the country, patients are falling through the cracks, some with some of the most severe mental health needs, waiting days in emergency wards for a bed, while others are being turned away entirely. Health practitioners say the system is overwhelmed and there's not enough staff or resources to keep up, and it's putting people in harm's way. In Australia, mental health accounts for 15% of the country's disease burden, second only to cancer. Yet it receives just 5% of our annual health budget. Pramudi Gunaratne is the New South Wales chair of the Royal Australian and New Zealand College of Psychiatrists, who's one of the experts calling for that to change. Pramudi, thank you so much for joining me on the briefing today. What can you tell me about the state of Australia's mental health space right now?
I think across the country, but especially in New South Wales. There's sort of one word that comes to mind, which is broken. It's really not a system, or the lack of a system, I think, is the problem. To give you some context, I suppose, for the history for how we've kind of come to this broken system, I think this is something that's been decades in the making. In the 80s and 90s, when the big mental health asylums closed and we moved to a more community-based model of care, funding was supposed to move from these asylums into community services. And while these closures were really important, the associated increases in community funding never materialised. And so what we actually have is kind of this hodgepodge development of community services without proper planning or integration. So we don't really have a system. So it's even hard to say it's broken, because I'm not sure there was anything really substantial and integrated there in the first place, but it's certainly just gotten from bad to worse, as we haven't seen any increase in that investment or development of proper services.
And we're hearing some really horrific stories from kind of all levels of the sector. There was patients, I think some experiencing psychosis, paranoid ideation, and others with schizophrenia, that were apparently waiting over 80 hours for care in one particular New South Wales hospital. What leads to something like that happening?
Look, it's absolutely horrible, and it's completely unacceptable that that's the level of care that we're able to provide. We used to talk about the missing middle in mental health. These are people who have, mental health conditions that are too severe for GPs and psychologists to manage alone, but they're not severe enough to access our overloaded public services. Unfortunately, what we've seen is that we've actually just gone from bad to worse. So we no longer just have a missing middle, but the threshold for accessing public services has just continued to rise, so that now even people with the most severe illnesses are not being seen. And so this is what you're seeing in emergency departments. People turn up, they've got the most severe, acute mental illness possible in terms of psychosis, and they're still not able to access care, which is an awful indictment on our system. And it's not even just about the severity of illness. Pick any area of our mental health system, whether it's eating disorders, child psychiatry, addiction services, trauma-informed care. I often describe it as like a threadbare rag. There are so many holes, and it just keeps growing.
And that kind of failing has also been brought to light in this recent inquest into the Bondi Junction attack. There were some witnesses that were claiming that they felt there were missed opportunities to kind of re-engage Joel Couchy with mental health support and recognise signs of psychosis. If people who are actively seeking care, like those we spoke about earlier, aren't getting it in a timely fashion or being turned away altogether, what hope is there for the people that aren't able to help themselves or don't have that kind of support?
Absolutely. I think there is a huge workforce crisis, and that was highlighted in terms of some of the missed opportunities in this case. But, we've seen things like in New South Wales, mental health presentations to our emergency departments have doubled over the last 10 years.
Wow.
But rather than growing our public psychiatry workforce, it's actually been shrinking. The government's own data shows that there are 58,000 people with severe and complex mental illness. So that's not mild or moderate, but severe and complex mental illness missing out on care. And that's the government's own reports and own data that's showing that. And so I think, that under-resourcing, and particularly the gaps in terms of workforce, lead to all of these missed opportunities, so people aren't getting access to care. We're seeing at the moment there are advertisements coming out for jobs desperate for a psychiatrist, because the service will close if they're not able to hire people into those services. And that's what we've seen over time, is that either there's a rationalisation of resources, so a single doctor or a case manager will be managing far more than what is safe, in terms of sometimes hundreds of patients with severe illness. And so you can imagine the limits to what an individual can do when they're put in those sorts of circumstances. Of course, there are going to be missed opportunities, because it's just not adequate or safe resourcing. And then when you take it to the next level, it's not just that there are not enough staff. Once you reach a certain point, you just close services because you can't run them. And talking to senior colleagues who were working maybe in the 80s or 90s, they were talking about, homeless health teams that were available, which we just don't really have widely available anymore, certainly not in New South Wales. There are pockets where that's available, but a lot of those services have closed because of under-resourcing, because of understaffing.
And just on this issue specifically, we've also seen many psychiatrists actually threaten to walk out over this kind of issue and saying that the government won't, and calling for the government rather, to increase pay, conditions and resources in the sector, or that they'll resign. Is the government listening yet?
I think this has been something that's been quite frustrating as a psychiatrist working in New South Wales, because it seems like the advocacy that psychiatrists have been doing around bringing back our workforce and increasing resourcing in the mental health sector has kind of been funneled by the government into the Industrial Relations Commission, and it's been seen as an industrial issue rather than actually a health crisis, which is what we've been talking about. We have never come to the government with a pay claim. What we've come to the government with is a workforce crisis and a plan for recruitment and retention. And when there is a pay gap between New South Wales and every other state in Australia, that becomes a natural part of how to remedy the problem, because what we're seeing is that we're training, a third of psychiatrists in Australia are trained in New South Wales, but then once our trainees finish their training, they go interstate or they go into the private sector. And part of what's driving that is remuneration. So I think that becomes an important part of that piece of the puzzle. This whole process started, over 18 months ago now. We were having clinical directors who run services across New South Wales contacting the college saying, we can't recruit people, we can't retain people, there is a real crisis. What can we do to be able to bring staff back? And so that's what we went to the government with, was we need a plan to build back our workforce. And I think one of the things that's important to understand is over many years, because of how under-resourced the system is, because doctors that work in the services don't feel like they're actually able to provide good care to their patients, we've seen this natural progression where staff have been steadily leaving New South Wales mental health services over years. And what that means is that the workload for those that are left behind increases, and so more people burn out and they leave. And then you eventually reach a tipping point where you just don't have staff to be able to run services, and also the remaining staff just start burning out at a higher and higher rate. And that's the sort of place we were heading towards, which is why this whole process started in terms of really advocating to the government to be able to figure out a plan to turn that around so that we don't reach that tipping point. But unfortunately, we just haven't seen any sort of meaningful, effective action to be able to turn that around.
And one of the solutions they've put forward was to try and allow existing healthcare professionals outside of just psychiatrists to try and help ease that burden. But you don't think that was the right move. Why is that?
It's like any other part of the health system. Without every part of that team, the system doesn't work. And it's the same with psychiatry. So you need a psychiatrist who has, 12 years or more of training, who's a doctor, who's able to prescribe medications if needed, who's able to diagnose a patient, and who's able to provide that medical care for that person. And you also need all the other elements of the team to be able to support recovery, but you can't replace one part of that team with another part of that team. There's definitely scope for looking at how we can do things differently, but I don't think replacing psychiatrists with other health professionals is really the answer. And what happens if you do that is that you have a two-tiered system where in the public sector, people don't have access to doctors when they're in a mental health crisis, and it's only people that are able to afford private care that will have access to doctors and psychiatrists when they're in a mental health crisis. And that is an incredibly unjust way to organise our health resources. And so I think we really need to have a system where it doesn't matter what your bank balance is, that you will have access to a doctor when you're in a mental health crisis.
Yeah, it certainly sounds complex and something that's going to need, I think, a multi-agency kind of approach to try and address. Pramudi, thank you so much for your insight and for joining me on the briefing.
No worries. Thank you so much for having me.
That was the RANZCP New South Wales Chair, Pramudi Gunaratne, speaking with me there about the state of Australia's mental health system right now. Thanks for listening to this ep of The Briefing. If you found it interesting, don't forget to leave us a comment or a review, or you can find us on Instagram at The Briefing Podcast. I'm Tara Cassidy. See you next time.
listener.